Hi everyone, Dr. Peterson here with Regions EMS, here for today's COVID update. Today is Thursday, April 2nd, 2020. Again, information presented today is current as of today, and there's no guarantees that it will be current tomorrow. So stay tuned to our website, regionsems.com. Click on the big COVID banner, and you'll find all the resources that we've compiled. We review those daily, and we update the date on that page so you can be sure that it is the most up-to-date information that we have available to us. You can also subscribe to our YouTube channel, Regions Hospital EMS, or email us, regionsems@healthpartners.com, with any questions. Today's topic will be exposures and testing. Before we do that, let's get into a couple of the statistics. According to the Johns Hopkins worldwide map that I think everyone's familiar with, 981,221 confirmed cases, with just over 50,000 deaths worldwide as of yesterday. CDC, as of last evening, is reporting 213,144 cases, with just over 4,500 deaths here in the United States. Minnesota, Department of Health is saying that we have had 742 positives out of 22,394 tests. The number of positives is higher than that because we're not testing everyone, but that's the confirmed positive rate that we have. And 18 deaths so far in Minnesota. Wisconsin, 1,550 positive tests out of 18,819, with 24 deaths reported. So the numbers are definitely going up. We're still probably 2 to 3 weeks away from our peak based on the best available models, which who knows if they're accurate or not. So we need to stay plugged into what's happening and make sure that you're familiar with the treatment options and the protection options that we're giving out. I've talked about the crisis standards of care. There's a few documents on our website regarding our plans to modify treatments, response patterns, transportations as we get into more of a stretched resource situation. Right now, we're still in what we call the contingency phase, which is the yellow phase, which means we've made some changes to procedures, but we are not modifying the standard of care at this point. So we're still responding to calls. We're still doing the right thing for patients. Regions Hospital has some workflow changes you should be aware of. Trauma team activations may be downgraded based on information you provide. It's not because they don't trust you, it's because they're trying to limit the staff in the room. So keep doing what you're doing. Use the guidelines, activate the trauma team appropriately, but just understand that you may get downgraded when you reach the hospital. Most of the critical resuscitations are running out of Alpha and Charlie pods with negative airflow rooms rather than Echo pods, so that's another change. ECMO, like I've been mentioning, continue to call the ECMO team. They're just not going to respond to Regions right now. They'll ask you to bring the patient to the U. And then finally, the last change that we're going to be implementing is that MRCC radio reports should be shortened. We'd like to go to the green, yellow, red triage model that is used by the West Metro. So you give a brief summary of your patient, some vital signs, and then a color code. Ambulatory stable patients for triage could be green. Obviously, the critical stay room patients will be red. Most everything is going to be yellow. And that'll allow you to shorten your report and not give the detail that you're used to giving. Again, volumes are down, so we're not necessarily there yet, but that is coming. So today, talking about exposures and testing. So testing is still limited. We hope this is lifting very soon. There are some new tests that are out right now. Some have a turnaround time in the hours rather than days. There's even some that look like it'll be minutes, more of a point of care type test, which will be excellent. That'll be a game changer. But we don't have access to all of that yet. So most patients that come to the ER or clinic are still not getting tested unless they really need hospitalization, or if they're a symptomatic healthcare worker or first responder, because we need to know if you need to be quarantined for 14 days or if we can get you back to work sooner. Along with that, so anybody that shows up for a shift needs to be screened at least every 12 hours. Temperature checks, symptom checks, cough, body aches, sore throat, that kind of thing. We have had people that develop symptoms in a short period of time, so we need to be monitoring, especially on these shifts where we're staying longer than 8 or 12 hours in one station with the same crew. We do have a document on our website for symptomatic first responders that talks about, there's a nurse triage phone number that you can call. identify yourself as a first responder, and they will screen you and arrange for testing if you meet the criteria. Again, you will be tested based on symptoms though, so asymptomatic people, if you're worried about an exposure, you're not going to be tested unless you develop symptoms. But feel free to call the line and they'll run through the algorithm with you. We also have a new algorithm that will be posted on our website that highlights how we would stratify an exposure. Is it a low risk, medium risk, or high risk exposure? And based on that, then what do? Do we quarantine you for high risk exposures? Do we just do closer temperature symptom monitoring? Should you be wearing a mask until we kind of clear things out? So there's some guidance in a document that we'll be posting that is our recommendations, but this decision is really driven by either your HR or your city's emergency operations center and your agency. So we are providing recommendations, but you need to work with your agency to decide how to implement them. If you are exposed to a possible COVID-19 patient, if you were wearing complete PPE, even in our algorithm, that is not considered a risky exposure. There is evidence out of Seattle that PPE does work. Even though Seattle Fire is seeing sick patients, the people that are wearing full PPE are not getting contaminated, at least directly because of PPE issues. It's more from contamination at the station or outside of work, that kind of thing. So if you're exposed to someone high risk and you're wearing appropriate PPE, no need to worry. Just use common sense, good hand hygiene, cleaning, social distancing, the usual stuff. There have been people asking us if there are tests available to see if you've had COVID-19. The answer is there kind of are, but we do not recommend the use of them. There are some blood antibody antigen tests available that are being sold by, I guess you could call them opportunistic marketers in some cases, that may or may not be accurate at all. If the Department of Health in Minnesota is out of testing reagent right now. If these tests were valid and were useful, we would not have a testing shortage problem. So we have to take this with a grain of salt. And even if you did test positive for having had the infection, that doesn't necessarily mean that you're immune from future infection. We don't know enough about this virus to make that statement. So just something else to keep in mind. All right, let's go back to our trivia question from yesterday. What is the best way to control the spread of COVID-19? Is it doffing, or dabbing? We did have a few guesses submitted. Mostly donning was kind of the theme that most people like to pick. And actually, kind of a trick question for April Fools yesterday. Donning and doffing refer to appropriately putting on and taking off personal protective equipment. However, that's specific to healthcare workers and cannot be generalized or assumed to be effective across a general population. So dabbing is being encouraged to limit the spread in the community. I'm not going to demonstrate it. You can Google it if you're not sure what that is. But in essence, you're going to sneeze or cough into your elbow, not into your hands or the open air. So thanks for everyone who participated. Today's question, hopefully this is an easy one. I'm expecting a lot of replies. Who was Mary Mallon? M-A-L-L-O-N. I think some rudimentary Google search skills will get you some good information on that. Send your replies, questions, guesses, comments to regionsems@healthpartners.com. Follow our website for updates. Stay safe, stay healthy. We'll see you tomorrow.